I'm so glad you're here. This is a replay of a live training I did inside the OTs for Pelvic Health Facebook group with Lindsey Vestal, and I wanted to make sure that everyone gets access to it. Pelvic health is such an incredibly fulfilling specialty, and it's growing so much. I've been training OT since 2018, and my goal is to have over 10,000 OTs trained by the year 2030. I'm so glad you're here learning about this specialty. I hope that you can join us in the OTs for Pelvic Health Facebook group with me, Lindsey Vestal. I will link to the group below in the show notes and description. Thank you so much. Hello, everyone. Welcome to our weekly OT Empower Hour, where we meet for, oh my goodness, almost 2.5 years now. We go live every single week, every Thursday at noon to talk all things pelvic health. We're rolling our sleeves, asking each other questions to be like literally the best OT, the best human being, the best practitioner we can be. And I am super excited to introduce fellow occupational therapist Jenny Diamond, and we are going to be chatting about what the current guidelines are what they actually recommend for exercising safely during pregnancy. Welcome, Jenny. I'm so excited you're here.
I'm so happy to be here. Thanks for having me.
Yeah, I want to give a little bit of background about you for those that may not know you. Before we do that, and before we get into busting a ton of myths, which I think what today's theme is going to be all about, and I love doing that, so I'm super stoked. The icebreaker question, and I'll ask it to you first, Jenny, and then anyone joining us live, please put your comments in because it energizes Jenny. We don't actually know you're here. Lexi's already here waving. Welcome, Lexi. It lets us know you're here, which just helps us to fuel our fire and be even more energized to be here. And if you're on replay, same, because it lets us know sort of what topics you're interested in. So as I continue to plan our calendar, I can lean more into those topics. So the question is, Jenny and Lexi, of course, I want to hear your answer. How old were you when you first learned to ride a bike?
Ooh, that's such a good question. I think I was about probably 7 or 8 years old. It was with a lot of pushing though from my parents. I was a very fearful child, very risk averse, still am. And so I had a lot of pushing and a lot of regular, let's get out, let's ride your bike. And eventually I got there, and I'm really happy I did, because now I can, join my friends, and on a nice day, there's lots of snow where I am today. I know where you are as well, but on a nice summer or spring day, I can get on that bike, and it was all worth it.
Speaking of which, have you seen these folks that get out there and ride their bike on the snow?
Yes. Is it with an e-bike or is it just a winter bike?
It's like I don't know enough about it. I just observed it. Actually, I saw it first when we were in France, and all I knew was it was like chunky tires that gave them so much traction. I was like, these are diehards, and this is incredible. So if anybody joining us, Mary Smith is here. She says she's excited. Myra is here. She's like really excited to be here. Anyone joining us, if you know anything about riding your bike on the snow, like let Jenny and I know, because we're super curious. To be honest with you, I probably won't do it, but I want to know more about this, because what a great way to continue writing. Also, like quick, like announcement, which is if anyone is planning on helping their kids how to learn to ride a bike, do the balance bike thing. It is a total game changer. So I have a 10 and an 8-year-old. The 10-year-old, lots of bumps and bruises, lots of scrapes, lots of tears, which I'm sure was your and I's story, Jenny, growing up, learning how to ride. And then my 8-year-old, we gave him a balance bike, which is essentially a bike without pedals. That vestibular sense he got just from playing without falling. And then the moment we put him on a real bike, he literally took off. It was incredible. Wow. Yeah, I have a video, but we love watching it. It's so great.
Perfect transition.
Perfect transition. Lexi says, like Jenny, she's very risk averse, and she learned to ride her bike around 7.
Nice.
Awesome. All right. So let me share a little bit about Jenny with you all. So she is an occupational therapist, and she is a pre and postnatal fitness trainer in Toronto, Canada. She's the founder of Jenny Diamond Health, which is an online platform that provides evidence-based exercise programs for new and expecting moms. Jenny's programs help birthing parents exercise safely during pregnancy, gain strength, gain confidence, and energy postpartum. And I am thrilled that your expertise is here. We need more of you. And what we really need is to talk about this myth busting, because I think that this is a topic that has definitely had its ebbs and flows, goodness, for a very long time. So I'm excited to be talking about the latest and greatest with you. And Jenny, my first question is, what do we know for sure? So based on ACOG, based on Canadian guidelines, what do we know at this point in time is actually safe for a postpartum person to do exercise-wise?
Yeah, that's a great opening question. And I think part of why there is so much confusion is the research is continuing to evolve. Like even, each year we see big changes. So I'll tell you, in referencing both the Canadian and the US guidelines, what hasn't changed, what we know from the research, consistent is aiming for at least 150 minutes of moderate intensity physical activity is the goal, spread over ideally 3 or more days a week. And then a combination of both aerobic, resistance, and pelvic floor training. The pelvic floor training is more newly supported in the research, which is really nice. And then we also know from the research the benefits of prenatal exercise, which are decreasing risk of gestational diabetes, hypertension, preeclampsia, excessive weight gain, depression, and also changes for the baby as well in terms of birth weight and overall health. So those are things we know for sure. And we also know prenatal exercise is not associated with miscarriages, preterm delivery, and also with small for gestational age infant. And so it's really just, unless you've been advised by your primary care provider that you have some contraindication that prevents you from being able to do this, it really is advisable for all birthing parents to exercise during their pregnancy.
Amazing.
Yeah.
And you and I have been in conversations around this for a while now. And one of the things we recently talked about was that the Canadian guidelines are a little bit more current, right? Can you talk to us a little bit about that, and even maybe some of the research that has come out beyond the guidelines?
Yes, absolutely. So, and what I'm hoping really to clarify for everyone today is, in addition to what we know for sure is, okay, well, what is sort of evolving in the research? What are things that sort of maybe gone back and forth a bit, things that are maybe a question mark right now, and what's being changed? And so I'm going to spell all that out, but just to sort of explain the order of how this has all developed. So the ACOG guidelines, so the American College of Obstetricians and Gynecologists, their guideline was put out in 2015, which is very consistent with the Canadian guidelines. There are a few things I'm going to speak to, though, specifically that have sort of changed or been updated since. The Canadian guideline is more recent. That was put out in 2019. And so there are some things in the Canadian guideline that are a little bit more up to date than the ACOG ones. And so that's important also to compare and discuss that. But even since that 2019 guideline, and we're now in 2023, like that's, we're almost at 5 years later here. So a lot of more research has come out. And so I also want to pull out, okay, well, what do we even know building on those 2019 guidelines, and really spell out where the research stands with these exercise recommendations.
That's awesome. Yeah. So I'm hoping we'll get more into that. And I'm inviting everyone joining us, please, at any time, throw your questions for Jenny into the chat. She is also in our group. So if you have questions during the replay, of course, throw them in as well. One of the ones that comes to mind for me that I think potentially could be a huge opportunity to bust some myths is, the age-old one where people say, don't exercise lying on your back. This is actually still in ACOG's recommendation. I did a quick review right before we jumped on our call today to make sure it was still there. And sure enough, they're talking about the weight of the uterus, compressing major blood vessels, restricting circulation. So what's the deal with that, Jenny? Is it okay for our pregnant clients to exercise on their back?
So great question. I'm going to answer it not with a yes or a no, but I'm going to answer it with here's what we know. Here's what the research says. So ACOG, like you said, specifically, they say to avoid long periods of lying flat on your back. And they also say maintaining a supine position after 20 weeks could result in decreased venous return. So that blood flow back, which should be considered when prescribing exercise. Now, the US physical activity guidelines based off of this actually go as far to say women should avoid doing exercises lying on their back during the first trimester because of the restriction of blood flow. So this is what the US guidelines have said. The Canadian guidelines are different, but I'm just going to explain a little bit about this. So we do know from the research that supine positions during pregnancy, they do compress the inferior vena cava and aorta. We know that. And the concern is that with this compression, this could result in maternal hypotension or reduced fetal oxygenation. And so that aspect of, that outcome of reduced blood supply or oxygen supply essentially is really what the concern is. And so what we need to know is, okay, well, is that decreased oxygen supply actually happening? So the compression is happening, but is there actually an effect on this for the baby, right? And so the Canadian guidelines have actually, based on more recent research, taken this to say that it's okay to exercise lying on your back as long as you don't feel unwell. So they say if you feel lightheaded, dizzy, or unwell while laying in the supine position flat on your back during exercise, you should adjust yourself to be either more upright, like a 15-degree tilt or more, or turn onto your left side. And so that's where the Canadian guidelines stand. And there is still research being done on this now, just to add in a little bit more with what the research says. So there is a recent review that observed that despite the compression of the inferior vena cava, again, which we know is happening, the majority of pregnant individuals don't demonstrate symptoms of hypotension. And so again, it's like, we know the compression is happening, but is there actually hypotension as a result? It's more so just speculated. And so that's why these guidelines have now changed. Why would we recommend this if we don't have proof, right? At the same time, we don't necessarily have strong research evidence that it's also okay. And so we don't really know one way or the other. There is one more recent study that was done on the impact of heavy resistance training specifically on pregnant individuals. This was done by Marky Davenport, as well as Christina Preved, if you're familiar with any of these people, anyone watching, Miranda Kimber, Lori Forner, and then Marlise DeVivo, I think is her name. And so they did this study on heavy resistance exercise, and they actually found that there was no difference in the incidence of reproductive complications between the respondents who engaged in supine exercise during their pregnancy versus those who did not. So again, more research showing there's no negative outcomes. We haven't found any, but it hasn't been pushed forward into a guideline yet to say this is okay. So that's sort of where we stand with the supine exercise. I would still really leave this as a question mark. I would say we don't have conclusive evidence that there are risks. I would say the potential risks are postulated, and we have seen some research that shows there's no adverse outcomes.
So thank you for that, Jenny. Very comprehensive answer. So my question related to specifically around lying on your back, are there other things that are like absolutely do not do based on either the research or the guidelines that we should mention?
Yes. So there are things that are clearly do not do. Activities to avoid, specifically activities in excessive heat, especially with high humidity. Again, across the board, Canadian and US guidelines, that's something that's not advisable. Any activities with increased risk of collision or impact or falling, that's a big no as well for obvious reasons. And then scuba diving as well has been noted as risky and should absolutely be avoided. And then there's sort of some things that are not necessarily activities to avoid, but safety considerations, again, that are conclusively stated. So maintaining adequate nutrition and hydration, right? Drinking lots of water before, during, and after exercise, that's one. And then there is some research also, if you're at altitudes above 2,500 meters, you should speak to your healthcare provider about this. Yeah. And then I was just gonna add one more. The other one that's not a do not do, but again, something that is conclusively said to, you know, speak to your healthcare provider about if you want to engage in vigorous intensity physical activity. And we'll speak to this a little bit more. I have lots to share with the research on that, but conclusively right now, both guidelines are saying if you want to work out vigorously, speak to your healthcare provider, and it's sort of case by case.
What is defined as vigorous?
That's a very good question. So so I'll start by saying how is moderate defined, because that is defined specifically in the pregnancy guidelines. And so on a scale from 1 to 10, moderate would be, sorry, let me take a step back. On a scale of exertion from 1 to 10, where 1 is you're barely working at all, and 10 is you're working as to the maximum. A 6 or 7 on that scale would be considered moderate exertion. Or on the Berg scale, which is a very silly scale because it's confusing for people. It starts at 6 and ends at 20. It doesn't start at 1. That would be 13 to 14, or sorry, that would be, 13 to 14 on the scale from 6 to 20 is considered moderate. It's considered somewhat hard. And so anything either above 14 on that 6 to 20 point scale or above 7 on that 1 to 10 point scale would be considered vigorous. Now, in the research, it's defined in different ways. So when we talk about vigorous exercise and how this has been studied, we do have a recent study that speaks to, for example, like Olympic lifting, which is like heavy, high intensity lifting. And in this research study, which I do want to share a little more either now or later, they defined the heavy resistance training as lifting greater than 80% of their 1 rep max. And so for people who aren't super familiar with 1 rep max and what that means. So if you were to take, let's say, let's take a shoulder press as an example. And if you were to grab weights and lift the heaviest possible weight you could lift just one time, 1 repetition all the way up, that would be your 1 rep max. So let's just say that's like 50 pounds, just for example. Okay, I can lift 50 pounds just once. That would be your 1 rep max. And so 80% of your 1 rep max would be something that is about 80% of that weight. So if you're quick with math, that's, I guess, what, 40 pounds is 80%? Is that right? I hope so.
Sounds about right.
Sounds about right. Someone correct me in the chat if I'm wrong.
Yeah.
Just mental math, you know? So 40 pounds could be like your 80%. And what's going to happen is if you're then going to lift 40 pounds, you're probably going to be able to get in a few repetitions with that if you could lift 50 just once, right? And so, but it's still quite heavy for your body. It's heavy lifting, as opposed to if you grabbed, 10 pounds, you could probably do that a whole bunch of times in a row, and that's lighter. So in this particular study that I'm referencing, they referred to heavy weightlifting as this, Olympic lifting greater than 80% of your 1 rep max. So there's sort of a few definitions there. And then the other definition I want to pull in, again, everything has multiple examples. This is where our research sits right now. It is evolving, but the talk test is a nice gauge as well. So the talk test is something that is in the guidelines right now. And what it recommends is that you, during exercise in pregnancy, you should be able to talk. And that is a sign that you are at moderate intensity and you're not pushing yourself too hard into vigorous exercise or high intensity. So they say, it's okay if you can't sing. We don't expect you to be able to sing. You can, work hard enough that you cannot sing, but you should be able to talk. So that's another way to gauge intensity.
That's a lot.
Yeah.
You can see why our clients are confused, why professionals are confused, and why we end up just erring on the side of caution, right? Mm-hmm. Because of course we want to do no harm. And so I do hope these things continue to evolve and empower people for what's going to be the most accurate and also the most individual, right? Listening to your own body and being able to gauge that as well, listening to the wisdom of that body. That's great. Okay, so I have another question about Valsalva maneuver, right?
Mm-hmm.
So this is something we hear a lot about. Is this contraindicated?
Great question. So what ACOG, and again, I'm going to take you through this process and then we'll get to this answer. So what ACOG has said about Valsalva is that there is potential injury and possible fetal heart decelerations from doing Valsalva. And so Valsalva is a breath holding technique whereby you do like a really heavy lift and hold your breath rather than continuous breathing. And so there is some recommendation to avoid, or sorry, not some recommendation. There has been a recommendation to avoid doing the Valsalva. Now we have more recent research that has disproven this. And so this was the same study, the heavy resistance training. This study was actually done just last year in 2022. It was released. So maybe I can link it in the comments for people afterwards. Yeah. So this study found that individuals who engaged in heavy resistance training during pregnancy experienced a low incidence of adverse reproductive and pelvic floor outcomes. And they actually, the prevalence of pregnancy and delivery complications were not different between those who engaged in the Valsalva maneuver and those who did not. So again, and this was similar with those who engaged in the Olympic lifting, to circle back to that. So those who did Olympic lifting and those who did Valsalva maneuver, no significant difference in pregnancy and delivery complications.
How, as somebody who's put together a really thoughtful platform, Postnatal Academy, how do you advise your clients on the Valsalva maneuver as it relates to pelvic floor health?
Mm-hmm. So both in my prenatal academy and my postnatal academy, breathing is always helpful and beneficial for your system. So I personally am recommending continuous breathing. I don't work with like CrossFit athletes. So my programs are designed to give people the foundations to have healthy bodies, healthy pelvic floors. And if these are competitive athletes, they would essentially go back to that next level of high intensity training once they finish my program. So for example, my postpartum program is a 12-week program, and we're not doing any Valsalva type lifts. We are doing high intensity strength training, and we are doing impact exercises and building up to doing all those things without pelvic floor issues and indications. And then if there are any that come up along the way, we then can work through those and prevent them and get the support needed. But Valsalva is not something that I specifically encourage or would even really touch with my clients, because it's really just not my population. And I personally feel that continuous breathing throughout exercise is beneficial in terms of pelvic floor health, and again, with the limited research, but from what we do know, even just with patient outcomes.
Yeah.
What is your take on that, Lindsay? I'm curious to hear what you have to say.
Yeah. I mean, and generally, a lot of the clients that come to us for pelvic floor issues are often using the Valsalva maneuver for complete elimination, right? So maybe it's definitely that bowel movement. Oftentimes it can be even urination. So those are often, in terms of really working with 3-dimensional breathing and being able to help that pelvic floor and that diaphragm connect. In that beautiful piston way that it can, we're often retraining Valsalva maneuver. So that's a conversation we have a lot with our clients. And so in terms of being able to specialize with working with athletes, I've actually had our own Audra on here before, and I'll link to that because I'd love, Jenny, for you to watch it as well. So she works a lot with heavy power lifters and has a lot to say about Valsalva and sort of the timing and technique of it. So I'll link to that for those that are interested in seeing it, and for you too, Jenny. But that is also not the community that I work with as much. So just more talking about everyday habits and routines and how Valsalva can often get in the way of, really helping that coordination between the respiratory and pelvic diaphragm.
Exactly. And I guess the other thing to note is that with the study that I'm referring to, the participants in it were people who have a history of doing this weightlifting. And so there is a possibility that they have the technique down. They're not just, the average person who's like straining to release a bowel movement, or when they're lifting a heavy weight, not knowing proper technique. So that is something to consider as well.
And the other thing is, talking about carrying over. So if you're working with a pregnant person, carry over into techniques for birthing, right? So what does mainstream media demonstrate, right? Is that purple pushing, that Valsalva pushing. So also doing a lot of education around how, we can actually aid our own body in terms of not using Valsalva for getting baby out as well.
Exactly. So I think it's really two different issues. It's like the health. Is there an issue with Valsalva with health of your baby? This research is maybe showing that, okay, no, everything's okay. You can do it potentially. But what are the implications on your pelvic floor? And that's a whole other can of worms.
Yeah. Pelvic floor, nervous system safety, feeling at ease. I think those are all the larger questions. But then again, coming back to that individual and their goals and their needs, and what they've been doing, even, up to the year prior getting pregnant. So again, like not everything, this is sometimes where guidelines are great. They're guidelines, but just really looking at that client in front of you and what their history has been, and what their techniques have been, even watching what they're doing. So maybe they don't even know what Valsalva is. So actually watching them lift or lift a weight or whatever, sometimes I've gotten my clients on commodes before, and we've talked about, how to actually eliminate. So making it as personalized as possible is huge.
And people don't know these things. They really don't, right? Unless you've been taught.
Right. Exactly. So if anyone is joining us, if they have questions for Jenny, please throw them in the chat. I've got one last one, so go ahead and type them in while I'm asking this one. I'd love to talk a little bit about HIIT workouts and sort of what your thoughts are there for somebody either who has been doing HIIT workouts and is asking about continuing them, or maybe someone who, as a pregnant person, is actually asking about starting to get into HIIT workouts.
Yeah, so this is such a good question. And the research is really evolving right now with respect to high intensity training. So, and this is actually something where, I want to flag any of you who are, really going by the ACOG guidelines, because that's our most recent guideline, that, in the ACOG guidelines, they do say that high intensity exercise can lead to hypoglycemia. And that is one of the reasons why high intensity exercise has previously not been recommended. And, steady state aerobic exercise, we know this is good, but high intensity exercise, it can lead to hypoglycemia is what these guidelines stated. Now, we again have very recent research from, again, last year, 2022, that looked specifically at glycemic response to high intensity intervals versus compared to moderate intensity continuous exercise. And they actually found no difference in the glucose response to an acute bout of high intensity exercise. And they also looked pre and post exercise, as well as 24 and 48 hours later. So they looked at, the whole spectrum of how people respond with their excess post excess oxygen consumption and that whole pathway. And they found there was no difference between these two different conditions, with the exception that fewer participants actually experienced the post-exercise hypoglycemia in the HIIT group compared to the moderate intensity steady state. So we actually had more people experiencing the hypoglycemia in the steady state compared to HIIT.
Unbelievable.
So this is really cool. Yeah, this is wild. And so this doesn't mean, though, that HIIT is okay. This just means that if our concern with HIIT or high intensity interval training exercise is leading to hypoglycemia, well, no, like this is disproven. Yeah. We know that's not the case. I mean, at least as per, this most recent study. And, we don't have a whole systematic review on this yet, because again, there's just not enough research that's been done on this, but this is the direction we're going in. And so we know that, this is less of a concern. And the reason why this study was done in the first place is because so few individuals are even meeting the pregnancy exercise guidelines. And we know that so many people find HIIT training way more enjoyable than steady state cardio. And, if that's going to motivate people to get exercising and do something that's going to reduce them and their baby's risk of adverse outcomes, and it's safe, then we need to know that, and it's really important. So that's sort of where we're at right now. And I know a lot more research right now is being pushed with this, at least from the colleagues who, I've spoken to about this with. So this is very exciting, and likely will be changed very soon. In terms of, again, this research was from last year in terms of what the guidelines say. So the Canadian guidelines 2019 and the ACOG guidelines 2015, they say moderate intensity, and they say check with your healthcare provider to discuss the risks and benefits of vigorous activity.
Awesome. That's great. So we've got a question in from Kirsten. Welcome, Kirsten, from North Carolina. Great to see you on here. She is wondering, do you recommend pregnant patients wear a belly band or some sort of support when they're participating in HIIT, running, or CrossFit?
Ooh, such a good question. Lindsey, I may pass this one to you actually, because I think from your experience with prescribing belly bands. So I personally don't really prescribe belly bands to clients. I usually refer to pelvic therapists for this aspect. And so I should give context. I am an OT by background. I don't treat clients as an OT for pre and postnatal care. I use my pre and postnatal training license for that. And so I have a separate OT practice. And so this one for me, I find is a little out of my scope. And I usually relate to pelvic therapists to assess on an individual basis for this.
Yeah. Yeah. So Kirsten, I'd love to hear your thoughts on it. I just threw into the chat an article on belly bands that I really like. So I have not in the past. Okay, that's not okay. I'm sorry. I'm thinking a few clients right now. So I've had a client who was on her fourth baby who I did recommend very gentle compression, and she was actually participating in a marathon. So I think it's definitely individual by individual basis. And I would say on like the larger context here is even if we have someone wear a belly band, usually it's postpartum is what I think about. So C-section recovery, even just those first few weeks on a very, typical vaginal delivery. I always talk about optimizing and thinking about times of day to wear it, as well as the weaning process. Why do I say this? I'm thinking about a client who I met 3 years postpartum, who was still living, breathing, and showering in her belly band. And so I always talk about, we need that support. Often our abdominal and pelvic floor and deep core muscles are still figuring how to organize and coordinate in those early weeks, early months. And so giving it a little bit of gentle support and compression is a beautiful way to provide support. But I'm often asking them to make sure to challenge and to step into and do like the exercises that we're talking about, or even the functional activities of unloading dishwasher at times when they're feeling best in their body. So sometimes right when they wake up versus maybe late at night when they're exhausted and they've had, the weight of the day still on them, or if they have a toddler and it's bath time and in dinner time, right? Putting the band on then. So optimizing when you need the support versus when you may not, and you feel at your best. Again, maybe early morning for some people. That was what it was for me. And then or very quickly talking about the process of what it would be like to stop wearing it. So, a gentle plan of being able to support when needed, but then also to be able to challenge as time goes on so they can really connect to those deep core muscles. And it's not a cookie cutter, right? It's really working with that person and leaning on the wisdom of their own body and what they're feeling at different times of the day. And that can absolutely fluctuate based on hormones, hydration, stress levels. So I always talk about sort of how do you know you need to put that belly band on? How do you know when it's okay to take it off? What are you feeling in your body? What are the connections we're trying to take? So super quick, and then I want to turn it back over to you, Jenny. That comes to mind is a client that clenched her jaw or even, squeezed her butt. And those are indications to her, okay, my core is not being optimized right now. I'm relying on some other support mechanisms within my body. So that was for her own clue. And I loved it. She found this herself. She's like, I'm taking out my compression belt, right. To do that. So, That will be my thoughts. Kirsten has joined us for another comment. She says, right, I definitely don't recommend them all the time. During pregnancy, I do find it helps with support if they have good posture and breathing. I personally use them through pregnancy to be able to continue walking on my feet and in the hospital. Awesome. I love that, Kirsten.
Yeah. And I was going to add, I think too, like using that OT lens, it really depends what are your goals, right? And so as you sort of alluded to, Lindsay, you know, you're not going to fix the problem if you're not building strength and getting stronger and working on retraining those muscles. And so when I think about, you know, a program like my postnatal academy program, that's not a time to wear the belly band. That's a time to work on connecting to your TVA and all your core muscles, pelvic floor included, and to strengthen things in order to get better and increase function. Yeah. And then, like you said, it's, you know, what are your goals? So when you think about these people who are doing more intense activity, what is the goal in that activity? Is their goal, are they an athlete and they're hoping to like score a personal best? Are they wanting to, you know, push themselves and get their heart rate up, but they're worried that their core can't handle it, right? So what is the goal of the activity there? And like you said, you know, picking and choosing times.
Yeah, I think that makes so much sense. Kristen, let us know if you have any other questions about that, but that was an awesome question. Jenny, while I'm waiting to see if Kristen or anyone else has any questions, can you just share with us verbally while we have you where we can find you, where we can connect with you? And then perhaps after we hang up, if you can come into the comments and maybe link to the Postnatal Academy or anything else, we would love that.
Absolutely. Yeah. So I have two programs. I am based in Toronto, but my programs are online. So I have lots of people in the States who are doing them. They're highly accessible. They are not a pelvic therapy program. They are strength training specific programs that support pelvic floor and that use evidence-based exercise recommendations in order to promote improved strength, confidence, and energy after birth and or during pregnancy. So you can find the programs. My website is jennydiamondhealth.com. My name is spelled a little uniquely. It's with an I, Jenni, then diamond, spelled just as a diamond is spelled, health.com. I will post it in the comments. And from there, any clients can, you know, sign up and access the program. I'm always happy to take calls with people as well. So if you have a client that you think might be a good fit, you can email connect me. Postpartum wise, the programs are appropriate for vaginal and abdominal birth, either or works. And then what else do I need to cover? And then, yeah, and very complimentary with any issues with incontinence and or prolapse. Like we go over all that and we build strength and learn how to modify around that. The only contraindication I would say is if a client has like severe pelvic pain, of course, like they need a lot of therapy and support to work through that first. But otherwise, super complimentary for any common pelvic floor issues.
Awesome. Thank you so much for your time and your expertise. We love having occupational therapists on here and seeing the breadth and width of how we're able to support pre and postnatal people. So thank you for being here. If you're on replay and you have questions for Jenny or myself, throw them in the comments. And really, really, really appreciate you being here. Oh, one last shout out, OT Pioneers. My program is open this week. So if you have any questions or are interested in joining me, please reach out before Friday. And super excited to see you all next week, same time, same place for the next OT Empower Hour.
Awesome. Thanks for having me.
Thank you so much, Jenny.